Hey guys, you're watching the Best Practices Show. We're going to take a look at the best business practices from the best dental practices anywhere. And I've got a huge treat for you. We've got Dr. Christian Coachman on tonight for a special edition. And we're going to be talking about the DSD workflow and how it's impacting orthodontics. You do not want to miss this. And it's a special question and answer session. I've got a bunch already. So do me a favor, grab a pen and hit the share button. We'll see you in a few seconds.
The Best Practices Show with Kirk Barrett is brought to you exclusively by ACT Dental, the ultimate provider of dental practice management solutions for dentists and their teams. ACT Dental is committed to helping you build a better practice and a better life. If you're looking to grow your production, motivate your team, get back on track, and create the practice you've always dreamed about, look no further. Give us a call at 800-851-8186 or visit us at actdental.com.
Hey guys, welcome back to the Best Practices Show. Having so much fun doing these, and straight from I think you're in Sao Paulo today, right? Sao Paulo, Brazil.
I am.
All
Today,
right.
I am at home.
Today you are home, and so you and I have been talking. We've been having a lot of fun doing these things. You're all over the place, influencing a lot of the popular CE sectors in dentistry, and so much of the talk on the DSD revolution. So we're going to be talking tonight about the DSD impact on the orthodontic workflow. And so there's so much to be said about this. And I know we got a lot to cover. I've already got a bunch of questions already. But before we get started, a couple things. We are shooting this live on Facebook. So if you have questions, feel free to add them to the feed, and I'll ask Christian directly while he's on the live broadcast. And then if you're watching it later on, which a lot of people are, continue to add questions to the feed, and we'll make sure that we do our best to get those questions answered, because we want to get the most out of this. Now, before we jump into this, I know, a lot of people that watch this know who Dr. Christian Coachman is, but if for some reason somebody doesn't, because we do have a lot of dental students watching this now, Christian, who are you? Where do you practice? Tell us a little bit about you before we jump into what we're going to be talking about.
So I'm Christian Coachman. I'm from Sao Paulo, Brazil, born and raised here. Did my whole dental education at University of Sao Paulo. I'm a dentist and also a dental technician. And since I started working as a technician for my father, there's also a dentist. We have a huge tradition in our family, 6 generations of dentists. The first one, my great-great-great-grandfather, started doing dentistry officially in 1848. That was the first one, and then in U.S. they moved to Brazil in 1868. Kept going. My great-grandfather, grandfather, my father, myself, my brother, my sister-in-law. I started working as a ceramist for my dad in 1994, and then in 2004 I moved to U.S. Worked as the head ceramist for Team Atlanta at the time, one of the best dental offices in the world, and then moved to Europe to work with some of the best dentists over there as well. People like Galip Curel, Eric Van Duren, Nitsan Bichacho, Mauro Fradiani, Andrea Ricci, and so on. And during this journey, developed a couple of cool concepts that really opened the doors of lecturing. Lecturing was always my passion. And the main topic 10 years ago, developed the digital smile design concept, DSD, that took me all over the world. And for the last 7 years, I traveled around the globe several times, 200 cities, 85 countries, and I have spoken for almost 100,000 colleagues for the last 10 years. So that's basically the summary. And recently, DSD became a serious company. And now I trying to become a serious businessman, running this company from our offices in Sao Paulo, Brazil, Madrid, Miami, and New York.
Well, you're doing an amazing job. I don't know how you do what you do, but it's pretty amazing. Now, one of the things that I'm fascinated about this, and the question comes up, DSD, that you were not looking to impact orthodontics, but why is it so strong in orthodontics right now?
That's a great question. As I said, I was just a technician. trying to develop strategies to improve my work for my clients. I wanted to do better for my clients, my dentists. My dream was to become a smile designer. Actually, that was why. Actually, before going to dental school, I wanted to become a designer, not a dentist. I was going into architectural offices, and my dream was to be an architect or a designer. And I only went back to dentistry when I realized that I could become an architect of the smile, smile designer. And when I started to do ceramics, I realized that the better I was becoming a smile designer, looking at the face, the more I was seeing the beauty of moving teeth to improve my restorative work. So moving teeth became a passion. As a technician, I was almost like wishing I could move teeth to place them on the ideal position to facilitate my work as a ceramist. But then I realized I had basically three challenges. First, I needed to improve my visualization. I needed to understand where teeth should be positioned to allow the best outcome of my work. So that was the first challenge. So I started to learn from orthodontists and from orthodontic surgeons and from denture experts what means putting teeth on the right position with the face. And if the teeth are not in the right position, what are the tools that you can use to move teeth in the right position? That the second challenge was then to convince my doctors, my dentists, my restorative dentists, that moving teeth was a good thing, and for that case, and usually people were like, you're not going to do ortho because it's going to take longer. I want to finish the case quickly. I'm not an orthodontist. I'm just a restorative dentist. So the second challenge was to create a communication between myself, smile designer, and the restorative dentist to show them the value of moving teeth, convincing them almost, or making us as a team understand this patient needs to move teeth before we restore the teeth. And then the third challenge was then to convince the patient. And that was a huge challenge. Patients don't want to do orthodontics, adult patients. So case acceptance, orthodontic case acceptance in adults was a big challenge. So these were the three challenges. So I started to work with DSD to improve my visualization to see where teeth should be, create a better communication with the restorative dentist to really create value on orthodontics for them, and then together as a team convincing the patient that ortho was the best option, and having veneers in 2 appointments was not the best option, but instead making 6 months, 1 year ortho and then doing orthodontics was the best option. So a lot of motivation was needed, a lot of patient education was needed, and that's when we started to use what we call emotional dentistry to increase ortho case acceptance in adults. So these were the three reasons why orthodontists started to really enjoy DSD doctors, because we were referring a lot of work to the orthodontists.
Yeah, and you could argue with the advancement in technology and what you're teaching, it's more accurate, it's less intrusive, it's quicker. Like, give us some perspective on how fast technology is changing, because I know you get to see a lot all over the world.
Yes, orthodontics actually was the first specialty in dentistry that really got into digital. With Invisalign, 20 years ago, they created a beautiful protocol to move teeth digitally and create appliances that could translate this movement into the mouth. Of course, at that time, CAD/CAM was starting, guided surgery was starting, but I would say that the ortho digital workflow was the first one to succeed business-wise. So when I started with DSD 10 years ago, one of the main things for me was the concept of guided dentistry, meaning that you can simulate the procedures, but then you need to deliver the procedures. Mm-hmm. And that's when I realized that aligner is the future, because when you simulate something digitally, you want a system that can replicate this as precise as possible in the mouth. Mm-hmm. So when you use aligners, you're actually moving teeth towards that digital simulation. That's why, regardless biomechanically pros and cons, this is not the point here, but I believe that aligner will take over and is taking over. First, because it's the best way to express a virtual simulation into reality, and second, because many extremely good and cool orthodontists are embracing this and really solving any kind of case with aligners.
Yeah. Now, Arjun just asked the question, can DSD work with any clear aligner system, or is it specific to Invisalign? And is it seamless integration?
Yeah. So the first thing is that basically the concept can work with any system. You analyze the face, you digitalize the patient, you have CBCT, STLs, you have the 3D files of the patient. You design the DSD Smile Design project, the ideal final outcome, and you start planning backwards towards the plan. If the plan involves orthodontics, on the DSD platform, you can move the teeth to generate a simulation. Now, what happens is that this STL file of the Smile Design project and the ortho simulation can be exported theoretically into any software, and you can replicate that. Our decision to work with Invisalign is very simple. We like to work with the best. We don't like to mess up. We like to take the whole protocol to the next level, So, we were able to bring DSD up to this moment completely commercial free, meaning that we were not connecting with companies. Mm-hmm. It was a philosophy, and people coming to our courses could use these ideas in any system with any brand. But we realized that at a certain point, we couldn't be like that anymore, because we are at the point that we want to go deeper into R&D. We want to go deeper into develop a perfect, seamless workflow. And when that moment comes, we need to pick a company to partner up. So that's what is happening with Invisalign now. We are collaborating and developing this complete workflow that is actually already available, and doctors all over the world are testing that. We can actually talk about how people can register to that later.
Mm-hmm. Yeah, no, that was a big question that came up. Now you've got companies working together in a fashion that maybe they weren't before with this, correct?
Yeah, because if you think about the restorative, for example, we have a very nice restorative workflow. We teach people how to do it with any system. But then we realize that we get to a very good quality with that, but now we want to get even better quality. When you get to that point, we want to pick a system like, for example, Anman Girbach, CAD/CAM system. We want to work with their engineers and go over every single detail that we believe can be better and make the protocol even better. So at that time, you can do DSD with any CAD/CAM system, but when we pick one and we develop that system to the highest level, of course, we will be naturally saying that if you go with these brands, you get the best out of it.
Mm-hmm. Yeah. Now give us some perspective, because this is game changing. What are we going to see in the future? Give us, some perspective in the next year or 2 years.
So from the ortho perspective, you're asking?
Yes.
From the DSD ortho perspective, yeah. So first concept is that, we are moving from moving teeth and aligning arches into harmonizing teeth with the face. So DSD is bringing the face to the digital ortho aligner world. As you remember, CleanCheck Pro, Invisalign software, amazing technology, but didn't have the face. So it was like being lost in space. So what we are doing now is developing this combined workflow where everything comes from the face, everything starts from the face, and everything needs to end in harmony with the face. The second thing is that for some reason the ortho world was always completely apart of the rest of the dental world. So orthodontists, they wouldn't even call themselves almost like dentists. They would say, "Are you a dentist?" "No, I'm an orthodontist." Yeah. Orthodontic meetings, you wouldn't see perio-prosto guys, and perio-prosto meetings, you wouldn't see orthodontists.
Right.
Very few people were making that connection. And to prove that, we from the perio restorative world, we don't even know the main names of the opinion leaders from their side, besides, Vince Kokich formerly was the ortho name that I knew for many years, and if you ask them about our guys, they don't know the name of our guys. So for some reason, there's this segregation, this separation that is not healthy, is not good for anybody. So we believe that through this DSD interdisciplinary digital platform, we are closing this gap. So before you know if the case is an ortho case, actually before you plan the ortho case, you need to know if the case is an ortho case. So that is the question, when the patient is walking into your office, the patient unfortunately the patient has not written in their front end, I'm an ortho patient,
Right.
So you need to look at the patient as a whole and understand what is your final goal as a full treatment, and then understand if ortho can help you. And if ortho can help you, you need to do ortho interacting with the interdisciplinary outcome. So that is the second change. Orthodontics needs to be planned from the interdisciplinary perspective, meaning it's not only the modern orthodontist will not only be good aligning teeth and creating beautiful class 1 intercuspation. The modern orthodontist needs to understand all the disciplines and move teeth to facilitate the other procedures. If we're going to do ortho plus perio, you have one ortho movement. If you're not going to do perio, you have a different ortho movement. If you're going to do ortho, perio, implant, crown lengthening, restorations, changing the bite, you need one ortho movement. So it depends on the big picture. What is the whole plan? So DSD is linking ortho to the whole interdisciplinary vision.
Yeah, Arjun asked another question that is fantastic. He's looking forward to using both of these systems, but had a query. If we want to change the occlusal relationship to CR, can the DSD and Invisalign work in sync? And give me the virtual articulation, virtual face bow transfers. And if yes, how accurate are the virtual face bows?
So first thing, there's the question is mixing two moments. So you have the brainstorm treatment planning moment that you're not worried about precision, you're worried about visualization. You're worried about test driving options and saying, this is where I want to go, and then you have a second moment. That's the clinical moment. That's producing devices. That's when you want precision. Okay. So the first step is to use technology to improve your visualization, improve your brainstorm, and make better decisions for your patient, regardless if you're going to use digital to actually perform the case or produce devices. So you can do classic orthodontics, but you can do better classic orthodontics if you use digital to brainstorm, see, simulate, test drive, pros and cons, make decisions, and then use whatever to perform. So yes, you can do, you can scan the face, you can combine with CBCT, you can have virtual face bows, you can have virtual articulator, you can bring the CR bite into the system, and you can do the digital diagnostic wax up, you can simulate orthodontics towards that wax up, you can check that ortho movement in relationship to the new CR position, and you can see visually very easily if you're moving teeth with the old bite, with the new bite, with restorations, without restorations, and make the best decision what you want to do. Now, once you have the plan, patient accepts the plan, now you go back to these files, and now you need precision. Now you need to actually use the files to produce an aligner and to move the teeth as close as possible to what you simulated at the beginning. And I can say that technology is moving very fast in terms of precision. From the restorative standpoint, we have a lot of precision. You can scan the CR and you can design restorations in CR and have very little adjustments in the bite in the mouth. From the ortho standpoint, you can also plan simulations on the computer based on this design and then fabricate aligners that if the orthodontist knows what he's doing, and the art is on the CleanCheck Pro. Computers will just do follow your orders. So you need to be an amazing orthodontist to do digital orthodontics. Don't get me wrong on that, and that's the problem. And if you plan properly, the aligners will move teeth towards where you want, and it's going to be very close. The final ortho alignment will be very close to the initial simulation.
Right. Right. And one of the things that this technology lends itself to is, you teach this so well, is the emotional component of dentistry, which dentists didn't often have at the early stages of this. A lot of times they would have to work up a case, put it all together, and that would be left out of the equation. But I've watched you do this several times, and patients get really emotional, and you haven't even really done anything yet.
Yeah. So that's the other thing that we are bringing to the ortho world. We are telling the orthodontists, look, we as restorative dentists, we need help to sell ortho for you guys. So let's work together on a strategy. If the patient is coming from the orthodontist or the restorative dentist, we need to work as a team to create full case acceptance. As my friend Miguel Stanley says, no half smiles, no half projects. If we believe on our project and we believe that that's the best for the patient, now we need to practice our skills to become better communicators and create this emotional link so people can value that. I was impressed when I heard from doctors years ago saying, I have on my initial questionnaire, is ortho an option? How can you ask that to the patient before you even know what is the ideal project for the patient? How can the patient know? Of course, the patient will always say, I don't want to do orthodontics, because everybody wants the easy solution, the fast solution, and patients sometimes they don't know what is the best. As I say, we need to protect them from themselves. So, it's not about are you willing to do ortho, is what is the best global, holistic, interdisciplinary plan for you? And orthodontist is a part of this puzzle, and we need to create value and be good communicators so the patient falls in love with the project and the patient says, whatever you say, doctor, I trust you and I want the best for me and I know what you're offering is the best for me. It's not going to, unfortunately, it's not going to be 2 sessions in 2 weeks. It's going to be 10 months of ortho, but it's a project that will be in my mouth for maybe 20 years. So it makes total sense. So there's no excuse for us as dentists not to present the global strategy for the patient.
Yeah, and so we're getting a couple questions coming in about workshops in UK, but Christian, we didn't have a chance to load up your slides, and I know you want to show a couple things just on the ortho side. Do you want to do that now?
Yes, we can do that.
And then we can answer questions when we come back, just to the discussion format.
So can you see my slides?
Not yet. Not yet.
Can you see it now?
I can't see them, but I'll tell you what. There you go.
Yeah.
But I could still see there you go. Perfect. Good.
Okay. So that's basically where digital ortho was coming from. Invisalign did an amazing job to develop an amazing software and amazing technology to produce aligners that can actually predictably move teeth. But we were still lost in space. You can see that there was just 2 arches. How can you position this in 3D? And there's no link between, for example, this case. If this case is going to have a gingivoplasty, the ortho movement should be different. If this case is going to receive veneers, the ortho movement should be different. So what is happening is that with the DSD idea, we don't start from there. The ortho is a consequence of an interdisciplinary facial-driven project. So before we jump into conclusions, what we want to do is digitalize the patient, analyze the face, develop a global diagnosis process, and create the most ideal outcome possible, and then plan retroactively towards the specialties to see what needs to be done. And when you do that, many, many times, we see the beauty of moving teeth to achieve that final result. So what happens is that Now, with this integration, we can bring the face into the game, and then we can simulate before suggesting ortho. We can simulate what means ortho with crown lengthening, what means ortho with the bite change, what means ortho with restorative, what means ortho with the bite lift, with CR, what means ortho with orthodontic, everything before we touch the patient. As we simulate this integration, we have a plan. We know exactly where we want to be, and we know all the tools that we need to use to get there. And then if ortho is among these tools, now it's time to present the project, sell the project, and then produce the devices to move the teeth towards there. So what you see here is actually, instead of just moving teeth without a final goal, what you see on the left side, it's just the model. On the right side, what you see in yellow is actually a facially driven project. So we test drive the project in the patient's face before touching the patient. We actually can place this project in the mouth, and we can create case acceptance. And what we can tell the patient is that when we start moving teeth, we're going to move teeth towards yellow. So yellow is the final outcome. So we're not just moving teeth, we are moving teeth towards the ideal facially driven project.
Mm-hmm. Fantastic. Fantastic. Now, how easy is it to integrate this technology? If someone's never been exposed to this, is this difficult? Is it fairly easy to do? Give us some perspective on that.
So we are on what we call an open beta testing phase. With Invisalign, both R&D teams are working together since a year. The workflow, it's up and running already. So anybody that wants to test a case can do that. You can send an email to info@digitalsmiledesign.com saying, I want to test drive the Invisalign DSD workflow. You need to pick a patient and say, look, this is a nice case. This patient probably needs ortho plus restorative. These are I would say, the ideal cases to test drive the workflow. Or even an pure ortho case, but you want to start from the smile design angle. So if you have a nice ortho case and you want to test drive the workflow, you send us an email. We will guide you through the process. You're going to upload the pictures and the STLs of your patient online to the DSD Planning Center. We're going to design the case. We're going to treatment plan the case with you. And then once we have a plan, we know exactly where we want to go. We're going to help the dentist to create what we call the motivational kit, patient presentation, motivational mock-up, case acceptance. And then once the patient accepts the case, the dentist will submit the case to Invisalign exactly the same way they always do. The only difference is that Invisalign will know that that patient has a DSD project attached to it, and our team will connect directly to Invisalign, so the doctor doesn't need to do anything. Actually, it's like submitting a case to Invisalign, but beforehand already having a DSD project attached, and this file will get connected to Invisalign, and the Invisalign technical team will utilize the DSD files to guide the ortho movements, meaning that the Invisalign aligners will be DSD guided, will be facially guided, and will be interdisciplinary integrated.
That's fantastic. Now, Victoria just asked the question, and I think you pointed to it. How much does it cost to test drive the case?
So the DSD project, facial analysis, smile design project, and this whole brainstorm, the price of this 3D project with the presentation and the motivational mock-up, it's, I believe, between $150 and $250 per case. Mm-hmm. Meaning it's cheaper than a diagnostic waxer, you know.
Right.
And it's according to the country. So rich countries, 250. We here down in Brazil, you know, poor countries, 150. So we divided the world in 3 levels. So you need to find out the country that you are in.
Absolutely. And we're going to post that information in the links and how you can do that. But any final considerations, Christian, you would point to, just, as a young dentist, we have so many young ones watching this. What would you tell a young dentist who might be watching this for the first time and isn't out there practicing yet?
I think young dentists, you guys are lucky because you're entering dentistry in the most exciting moment ever. Dentistry is changing, the business is changing, and you guys are naturally born into this holistic, sharing, digital world. So whatever is where dentistry is going, it's going to be much easier for you guys to embrace these changes. Every time I speak to doctors that are already in business for 10, 15 years, they struggle through the process of making this change happen. Mm-hmm. When I talk to younger people, they don't even have questions about it. That's the way it is. It is digital. It is connected. It is facially driven. It is all about the customer experience. It is about the coolness of the process, utilizing cool solutions to make your patients become huge fans of yourself.
Right. A couple other questions that people want to know. Is this integration available in Australia and Latvia? Do you have representatives there?
This integration is available anywhere, and that's the beauty. It's online. It's in the cloud. It's what we call cloud dentistry. So if you go to digital DSDplanningcenter.com, you can upload your case tomorrow morning. You upload the photos, we do the design, you upload the STL or the scan of your models. It's very simple. It's 5 photos, 1 video, and an STL file, and we can have everything done. You go, again, DSDplanningcenter.com. You log in, new case, upload the information. After 3 days, you have the information. You present the plan, you sell the case. You go to Invisalign, we connect to Invisalign, and you can become part of this pioneering beta testing worldwide group of dentists that are doing digital orthodontics connected to restorative, facially driven, interdisciplinary oriented, extremely cool. And if you tell these stories, if you explain to your patients the technology that we are using, and you're going to be able to explain, because we're going to give you the material to create this amazing storyline for your patients. Patients don't believe. They say, wow, it's so cool. I didn't know dentistry was that cool. I thought dentistry was boring, and now I'm a huge fan of this. I want to tell my friends about it.
Yeah, it's very cool. And if you haven't seen Christian live at a workshop, you have to. And you've got a huge schedule of some very big meetings in front of you. You and I are going to be together at the DSD Day at the Seattle Study Club Symposium, which will be a full day, which you cannot miss. We'll post a link to that. But then also you're going to be doing some work with John Kois. Can you just mention that a little bit and what you're up to?
Yeah, this is amazing. Through DSD, we had the opportunity to have the endorsement of amazing people, to collaborate with amazing companies, to gain the respect of amazing people because of what we are developing. And you mentioned one, working together with Seattle Study Club was a huge moment for us to have Michael Cohen endorsing the whole DSD philosophy. And more recently, starting to work together with John Kois, one of my main mentors and one of my dental idols, and really interacting with John and seeing how open and how humble the guy is after all he did for our profession is just amazing. So we have the DSD residency at his center next month, happening in December in Seattle. We still have very few spots available, so if you're interested, also just look online, digitalsmiledesign.com, or send us an email, info@digitalsmiledesign.com, and you can participate on this event. But this is going to be very special, not only because it's a DSD course with John Kois there and his team, but because we're going to be performing for the first time a full case with John. So John and his team are actually doing a first complete digital DSD case together with the DSD Planning Center team. So we are flying our surgeons from Madrid. Dean Coy's, Dr. Coy's son, that is an amazing surgeon, will be doing the surgery. John Coy's will be doing the whole immediate loading, prosthesis, provisionalization. It's a big all-on-4 case, full extraction, amazing digital planning. And by the way, we're going to be planning live this case next week with you, Kirk, right?
Mm-hmm. Yep.
So I don't know if you want to invite people already to this session. You know?
Well, I'm going to post a link to all of those, all the things that we mentioned. We'll post all of those links so you don't want to miss that, and make sure you reserve it in your schedule. It's going to be fantastic. This will be the first time we've pulled that off, and I'm really looking forward to it. It's going to be a lot of fun.
Yeah, it's not every day that you can treatment plan live with John Coy's online for thousands of people all over the world. So
yeah,
we're gonna have John Coy's brain with full digital technology supporting his brain to deliver the outcome that he envisions.
Mm-hmm. Do not miss that. So more to come from Dr. Christian Coachman. We got a ton of other shows and other things we're going to be bringing you over the next couple of weeks. So don't miss it. So Christian, stick around while we say goodnight to everybody else. But thank you, my friend, for just, I know you got a lot going on. You got your family there. So thank you to your family for sharing, this time with us. And for those of you watching, thank you so much for tuning in. We had quite a few people tune in and some great questions tonight. If you found this valuable, do me a huge favor. Just hit the share button, share it with your friends. Obviously, we'd love great information like this to get out to all of our colleagues and protect this profession we love so much in dentistry. So until we see you next time, keep watching the Best Practices Show. You guys have a great evening.